Hello, I'm Dr.Jyothi speaking, fertility expert leading team Ferty9. Today I'll be discussing about the common condition, like most of the doubt what a couple express. They need to know the fertile period to plan pregnancy quickly. What are those dates when they are together, the pregnancy chances are highest probability. So we'll discuss about that. To know this, we should know about the safe method and the fertile method. To have a depth knowledge, we should categorize. Very important is we should know when the woman ovulates, that is ovulation. The egg is released from the ovary. This is the tracking of ovulation. How do we do it in a calendar method? So I'll be telling you about this method. We need to categorize about lady's cycle. Like for example, we can most of the time a lady gets cycle once in every month. That is, say suppose she gets on June 1st, she will get it on July 1st. The ladies are called as regularly cycle ladies. They have regular cycles. Every month they have one cycles. Second category is ladies have regular cycle but not once in a month. They get once in 1.5 months, once in 2 months. But it is regular. Every 2 months once they get. That is category 2. Third category are those ladies where they don't know when they have their cycles. Suddenly they have their cycle in surprise, sometimes once in 1 month or sometimes once in 2.5 months, once in 3.5 months. So I will just categorize and tell you when to calculate that fertile period. So first we will take the category 1. In category 1, that means a lady having regular monthly cycles. That is, if she gets on June 1st, again she will get in the July 1st around. 1 or 2 days here and there, doesn't matter. So once she gets cycle on June 1st, then the next cycle is again on the 1st. So total we have 30 days here. So ovulation usually happens at the center, in the sense 14th day, around 14th day when she has a regular cycles. So around 14th or 15th day she may have her ovulation. So how do we track this ovulation? So what is the fertile period? Is 5 days before ovulation and 5 days after ovulation. So in this lady who has cycle on 1st June, her ovulation is somewhere around 14th or 15th. So if we calculate her fertile period minus 5, so it will be from 10th, 11th, 12th, 13th and plus 5, that is 14th, 15th, 16th, 17th, 18th, 19th and 20. So her fertile period, that means to say when her egg releases and when she has to be with her partner, is from 10th to 20th day of the cycle. Say suppose some couples who are just married, who don't want to plan a pregnancy, they want to use it as a contraception, in the sense they want to know what are those safe dates when they are together, that the lady will not become pregnant. So the safe dates are usually in the first day of the cycle, first, second and third day when she is having her bleeding, they should not be together. So once she is fresh, from 4th, 5th, 6th, 7th, 8th, 9th day are the safe days where the chances of pregnancy is very, very less. And then after this period, that is after the fertile period, that is 21st to 30th date, it is a safe time. So probability of pregnancy is very, very less in this method. When ovulation happens, so we need to understand the center of the cycle is the fertile period, and the starting 5 days and the last 10 days are not fertile periods, safe periods. So if we follow this method, almost in this fertile period 80% chances are there to conceive. This is for ladies who are having regular cycles. But then for some ladies who have cycles once in 1.5 months or once in 2 months, if it is regular also we can calculate. So how do we calculate? We should know that, say suppose every 2 months she gets her cycle, the last day of the periods, in the sense when she will get, from that we have to minus 15 days. So that is the ovulation time for her, because it is very much fixed that the day she gets the periods, from then last 15 days is her ovulation time. So during that time, if they are together, chances of pregnancy is very high. So this method can be done for people who are having regular cycle. So what about those ladies who don't have cycles regular? They have their cycles once in 2 months, 3 months, 4 months, 6 months. We do see ladies like having cycles once in 8, 9 months also. So how do we time ovulation for them? Very, very tough. So these ladies, we ask them to come to the hospital. We do a small scan and we will know when the eggs are releasing, and then we tell them to be with their partner. We can track the ovulation through scan in these ladies. So definitely if they practice this calendar method, they can work on planning for a pregnancy. But according to all evidence and according to other studies, what we say is, if we are planning for a pregnancy, we don't have to bother all these methods. If they are normally, naturally, happily together, most of the time 80% of them without any treatment can conceive naturally within 1 year. So keeping all this in mind, we can plan a pregnancy. Thank you so much.